in the last 14 days. So we want to actually continue to break down these requirements and understand a little bit more about where they are coming from. So joining us now is Dr. Aditi Nerurkar with Harvard Medical School. Dr. Nerurkar, where did these rules come from and how did they decide that this is the box that they were going to put them in?
So Tabitha, these vaccine requirements are much too narrow, and they focus mostly on this particular population of men who have sex with men, because 98% of cases right now in the US are in that subgroup. But it also paints the picture erroneously that monkeypox is a sexually transmitted infection, which it is not. The mode of transmission of monkeypox is prolonged skin-to-skin contact, not necessarily sex. So we do need to broaden these eligibility criteria for vaccination. The real driver for this is that the supply of vaccine is much less than the demand, and that is why these constraints exist.
So if you were to make vaccine requirements, Dr. Nerurkar, what would they look like?
In an ideal situation, we would have ample vaccines available for high-risk groups. So that includes men who have sex with men, but it also includes, like you just reported, pregnant women, children, the elderly, those who are immunocompromised, and those with chronic medical conditions. Currently, vaccine requirements by the CDC and New York City are much too nearsighted, focusing on exposure and particular groups rather than focusing on risk.
And Dr. Nerurkar, I actually spoke with another doctor, Dr. Lahita, last week about this. And what I thought was interesting is he talked about there is some discrimination within the medical field right now for individuals who are looking to get treatment. But there's also another section of that that's less discrimination, more that there are medical centers that don't know how to treat someone with monkeypox. So how do we essentially bridge that gap and make sure that people who need help, whether they need a vaccine or they need treatment, can get it?
So just this week, Tabitha, the White House had a federal response meeting on monkeypox, and the four levers that they're really trying to push forward are increasing testing, because we know that testing capacity is low. Our latest numbers show about 5,000 cases of monkeypox in the US, but we know that that is undercounting simply because there aren't enough tests available. The second is we need to ramp up and boost vaccine supply, because as we are seeing, there are long lines at clinics. I myself tried to go on the New York City website to get myself a vaccine appointment just to see what would happen. And again, weeks and weeks out to get an appointment just as a test. The third is that we must educate people. So we must educate the public on what monkeypox is, what to look for, demystify and really break down any disinformation that it is not a sexually transmitted infection. And finally, we must educate clinicians, because not every clinician knows what to look for.
For our viewers who are watching right now, how would you advise them to be prepared? Obviously, if they can get a vaccine, to get one. But for the general population, what should they know about symptoms they should look out for, or things that they should be looking for if they come into contact with someone who has monkeypox?
So at present time, we do not have enough vaccines for everyone. And so at this moment, it is not advised for everyone to get the monkeypox vaccine. So you do not need to sign up. I did it as a test prior to this segment as research, but there is no need to seek out a vaccine. However, if you have been exposed to someone with monkeypox within the last 14 days, then it is imperative for you to reach out to get tested and get a vaccine, because we know that these vaccines work within several days of exposure and symptoms. Also, if you have any new sores or lesions, new rashes that you are unsure of, talk to your physician. At this stage, there is no cause for panic or pandemonium, but we do need, as a public health community, to stay on top of this and get ahead of the curve. Just today, we saw the highest rise in cases in monkeypox nationally, and so we really do need to prioritize this.
As we look ahead, how long do you think it's going to be before here in the United States we have curbed the monkeypox outbreak?
So that really is the million-dollar question, Tabitha. We're hoping that the window has not closed. We do not want monkeypox to become endemic here in the U.S. It has not been an endemic disease, and we want to keep that so, which is why there is a push for increasing testing and vaccination. Currently, we have 800,000 vaccines that have been approved by the FDA, but only 300,000 that have been mobilized here in the U.S. About 2 million will be available by this fall, And in early 2023, we'll have another 2.5 million. So there is much that we can do now to prevent any further expansion of this, but we do need to act swiftly.
Dr. Aditi Nerurkar, as always, thank you so much for coming on and sharing your medical expertise.
Thanks for having me, Tabitha.